Hello everyone, we are from team BiomediSkin, and today we're going to introduce our newly innovated bandage called PsoriAid, a bandage for psoriasis. First of all, what is psoriasis? Psoriasis is an autoimmune skin disorder in which skin cells proliferate up to 10 times faster than normal. Overproduction of keratinocyte can contribute to this condition, which later cause the skin to thicken up into rough red areas coated in white scales. Psoriasis affects millions of people from any age, sex, or race. According to data in 2016, psoriasis has a reported prevalence throughout countries that ranges between 0.09 to 11.4% worldwide. As for 2017, Global Psoriasis Atlas has reported that in Indonesia, roughly 797,800 Indonesians were affected by psoriasis, which later emphasized the emergence of our product. Therefore, PsoriAid is dedicated for persons with psoriasis, particularly those looking for an alternative to steroid or biologic treatment that frequently have side effects. Our products also targeted those individuals who lead busy life and are engaged in their communities, including women or men. Psoriasis usually appear in early adulthood. For most people, psoriasis leads to skin patches that start off in the small areas. However, in severe cases, the patches slowly grow larger and develop thick, dry plaque. The symptoms include redness, itchiness, scaly and peeling skin, dryness, as well as rashes. In addition to this, some patients may feel self-conscious. Thus, our product offers an adhesive bandage with an extensive coverage that lays with hydrogel to give soothing effects that can alleviate psoriasis symptoms. It is also include aesthetic design that function to cover up the skin condition.
Next, we will be discussing the product design for our psoriasis bandage that is designed for relieving psoriasis symptoms. Here, we designed the box packaging to have a dimension of 12 x 2 x 22 cm and with an additional hand tag that allows easier display in stores. To start, on the front face of the box, the packaging will include the product's name, an illustration of bandage adhered to a psoriasis lesion, a summary of the advantages provided by the bandage, and a short description of the bandage functions. Then, on the left face of the box, a fun fact concerning psoriasis with our design mascot will be inserted there. Next, the back side of the box will include the list of ingredients for the bandage production, a step-by-step on how to use the product, expiration and manufacturing dates, a barcode for easy cataloging in stores, and a QR code to the link for BiomediSkin official website. Lastly, the right face of the box will have the size chart of the bandages contained inside the box. Additionally, it can be seen that the box has dotted lining of perforation that eases consumers in opening the box. Next, we have the design mascot for psoriasis packaging here, and we have researched the reported sizes of skin lesions emerging on psoriasis patients to be around 0.5 to 20 cm in diameter. Therefore, we designed our bandages with varying sizes to properly cover these variety of sizes of lesions. Moreover, we decided to add a hydrogel pouch in the bandage to provide physical protection against mechanical damage and other infections while also maintaining moisture on the lesions that ultimately improve the healing process by affecting the stage of wound repair. This hydrogel pouch is infused with St. John's wort oil for anti-inflammatory treatment against psoriasis symptoms. We finalized on adding St. John's wort oil because the flower has been reported to reduce scaling, redness, and skin thickness, while also reducing the production of inflammatory contents near the site. This oil contains quercetin, hyperforin, amantaflovin, and hypericin, and thus will serve as the main active ingredient in psoriasis bandages. These designs provided by the psoriasis bandage will become leverage for our product to stand out in the market for psoriasis over-the-counter products.
Now, let's talk about the pricing strategy for the PsoriAid bandage. This section covers the breakdown of the prices that eventually determine the selling price of each bandage. First and foremost, it is important to address that the pricing strategy was only made for the biggest bandage size, which is the 10 x 20 cm bandage, since it would set a standard for how the smaller bandages would be priced. With that said, the detailed calculation for the cost of materials per individual bandage is shown in this table, which includes the original price of the material per quantity of purchase, along with the calculation for the price of each material through adjustments with the required quantity. In total, 7 materials will be used to make each bandage, where their quantity and pricings are obtained through either Made in China or Amazon online shops. To briefly talk about each material, the bandage itself will be made of a ketosan dressing pad, in which the pouch for the hydrogel will be made of non-woven fabric and attached to the ketosan pad. Release paper is used to line each bandage to prevent it from sticking to one another in the packaging. As for the hydrogel, it utilizes sclerotium gel dissolved in distilled water as its polymer base and will be infused with 5% St. John's wort oil. This oil concentration was specifically chosen since Mansouri et al. Proved this concentration to be effective for mitigating psoriasis. Lastly, the packaging will be made using duplex cardboard paper with the design printed on it. For easier viewing, the summary of the material cost in the previous table is shown here. The price of each individual material in Indonesian rupiah adds up to 3,292.33 rupiah per bandage. Considering that 100,000 bandages will be made per production batch, the direct material cost is calculated as 329,233,000 rupiah. Meanwhile, the direct labor cost is estimated to be around 18 million rupiah. As for the fixed and variable overhead costs, they are estimated to be 455 million and 95 million rupiah respectively. The former includes the cost for building and machinery depreciation, taxes and insurance, and also supervision of the production process by experts. The latter, on the other hand, takes into account the cost for indirect material and labor, power and electricity, and also the repair and maintenance of the machines and building. The detailed estimated prices can be seen from the tables in this slide. Now, after obtaining the direct material and labor costs, along with the fixed and variable manufacturing costs, the absorption cost for the production of one bandage can be calculated, which is roughly around 9,500 rupiah. Now, based on this value and the desired profitability of 40%, the selling cost of one bandage is determined as 13,429.26 rupiah.
Moving on to the riskiest assumption test regarding our PsoriAid bandages, which is calculated using the probability of wrongness and level of impact towards the business when the assumption is wrong. First is the customer risk assumption, which is listed as the following. People with psoriasis are willing to pay approximately 45,000 rupiah per pack, which consists of 3 pieces of bandages, and it has a risk level of 14. Entertainers, artists, or influencers are willing to pay more than the market price for treating and or hiding the dry and flaky skin, and it has a risk level of 12. However, people with sensitive skin might not buy this product because it may increase the chance of inflammation, so it has a risk level of 2. Second RAT is the problem assumption. Psoriasis patients suffer from constantly dry and flaky skin along with rashes, and it affects a large portion of the skin. Moreover, constant scratching and itching makes the disease worsen, where all of them have a risk level of 8. Psoriasis patients are also self-conscious of their exposed skin and might want to hide it, and it has a risk level of 18. The third RAT is the solution assumption. The addition of hydrogel that is infused with natural extract called St. John's wort oil can solve the dry, flaking, and itching skin whilst also mitigating the psoriasis symptoms, and it has a risk level of 20. A large surface area of the bandage provides a wide coverage to cover the affected skin area, and it has a risk level of 8. Moreover, aesthetic design such as mimicking the color of the skin to cover the skin condition has a risk level of 2. The fourth RAT is the minimum viable product, or MVP in short. The materials are commonly found in Indonesia, especially the natural extract, and hence it is feasible to be mass-produced, and it has a risk level of 9. However, the natural compound extraction might need a longer time to process to obtain the crude extract, so it has a risk level of 24. The fifth RAT is the competition assumption, which is that our product possesses advantages that can compete with the currently available psoriasis treatment in the market, including reducing symptoms and healing the skins, and it has a risk level of 24. The last RAT is the sales channel assumption. Products should enter the drugstores such as Guardian and Watson per month, and it has a risk level of 32. Products should be able to be distributed to commonly found convenience stores such as Indomaret and Alfamart per month, and it has a risk level of 18. An official store should also be set up in e-commerce, including Shopee and Tokopedia, on a local server, and it has a risk level of 2. An official website should be made available for selling and customer service, and it has a risk level of 4. Next is the solution for the assumption with risk level above 20. The highest risk level is 32, which is introducing the bandages to the drugstore. The solution will be that other alternatives such as the convenience store and online store can be used to sell the bandage widely throughout the globe. The second one is competing with currently available treatment with a risk level of 24. To prevent this, the brand should highlight the advantages even further to gain interest from the target customers and provide testimonials to appear and gain trust from the public. Another one is the long processing of the natural extract with a risk level of 24, and hence the most efficient method of natural extraction should be researched and selected to produce the extract in high yield. Last but not least is the addition of hydrogel and natural extracts to the bandage with a risk level of 20. The solution is that to research for alternative natural sources that may have higher therapeutic index to minimize irritation to the skin and also reducing the psoriasis symptoms.
So the next topic that I would like to discuss is about the business model canvas. My first point is about the customer segments. So we will distribute our products to patients with psoriasis, including the entertainers or artists, as well as the patients who are self-conscious with their skin. And also the second point is about the customer relationships, in which we have to maintain our existing customers by providing some list of questions and also online chatting customer service on our official website. So next is the channels that are important to expand the distribution of our products. And since our product can be categorized as the healthcare products, thus we will make a collaboration with the drugstores such as Watsons and Guardians and also the pharmaceutical store. We will also use the e-commerce such as Tokopedia and Shopee to sell our product to make it easy for the customer to buy our products. And moreover, we also use the online media platform to advertise our products such as TikTok and also Instagram. Another important key is to choose the key partners that includes organizations or individuals which will collaborate with our company to build a strategic alliance. Several key partners are the pharmaceutical company, hospital, bandage company, drugs and pharmaceutical stores, IT company and freelancer, which will help us to design the website and the features. A design company are freelancer, which play roles in making the logo for our products as well as the herb supply. Moving on to the key resources and key activities, but I will explain the key resources first. First, the materials of the bandage that are going to be used is the elastic cloth, and our bandage also use the natural extract and hydrogel as the ingredients. The design of the bandage itself is handled by the designer and the production team involved the researcher and also the quality control. Last but not least is the infrastructure of the factory. The key activities begin with the retrieval of the key components for the bandage from the distributor, followed by doing the research and development of the bandage. Clinical trials also necessary for the bandage before the distribution process, and after the trials are done, we can continue to start producing the bandage in a big quantity, and lastly is the market surveillance for the bandage. The cost structure of the bandage is divided into 5 important points, including the material acquisition, research, production, designing and branding, marketing and distribution, as well as the infrastructure. The materials acquisition include the elastic cloth and also the natural extract and hydrogel, while the research will be done by formulating the bandage. Doing some clinical trials and the marketing surveillance is also necessary. And last but not least, the infrastructure for the storage, production of the bandage, and also the management team. The production of our bandage has several purposes. First is to help the customer to relieve psoriasis after applying the bandage that contains natural extract. And the bandage is also designed to cover the scars and also the skin to prevent scratching, which would worsen the dry and also the flaky skin. Moreover, the bandage will also exert a cooling sensation to the skin. And last, the point is our team will always maintain and control the accessibility to obtain the bandage. And the last point of the business model canvas is the revenue streams. The point of revenue streams including the direct selling in drugstores, online selling through the e-commerce and official website, export the product to other countries which have higher prevalence of the psoriasis, and lastly is the collaboration with several pharmaceutical and bandage companies.
let's talk about the competitors that have the same purpose to our product, which is providing a medication to treat psoriasis. So we found 5 top products that are sold in the Amazon, including CeraVe, Kenkoderm, Time Out, BiomediSkin, and QRX Lab. As you can see from the table right here, each of the product has a different form to treat psoriasis, including cream, hot soap, spray, oil, and pad. To easily see whether the product is very expensive or not, our group tried to compare the price, excluding the shipping cost and tax converted to rupiah, with the net volume or weight of the product. You can clearly see that there are 2 products, BiomediSkin and QRX Lab, that are significantly have higher price per volume or weight. Now moving on to the ratings of each product. In general, all products have a pretty good ratings, ranging from 4.2 to 4.5 out of 5. In terms of popularity, CeraVe and QRX Lab seem very popular compared to the others, since more than 10,000 people have reviewed this product in the Amazon website. Now let's talk about the strengths and weaknesses of our competitors and our product itself. First is CeraVe. We can say that CeraVe is the most popular product, and this reputable branding makes people put more trust to buy this product. We can use this product by pumping, therefore the product itself will not be easily contaminated. The major weaknesses of this product are, this product is not convenient to carry around, not long lasting, especially for people who sweat a lot, and cannot cover the psoriasis patches. The second product is Kenkoderm. This product can replace soap that is used daily, and this product is fragrance free and use natural coloring, so it is sensitive skin friendly. The weakness of this product is not too long lasting, since the soap is not adhered to skin all day. The third one is Time Out. This product is available in travel size packaging, therefore it is very easy to carry around, and it appears in the form of spray, therefore it is very easy to be applied, but this product it can only be used for adult. Next is BiomediSkin. It has the same strength with Time Out, and since it is an oil-based product, it will moisturize the skin more than water-based product. The weakness of this product is that this product comes from a small business brand, so it is harder to get trust from the customers. And our last competitors is that QRX Lab. The strength of this product is this product treats the skin directly by compressing the skin, making the skin moist. However, it just can exfoliate the skin for a very short time, as it will easily dry out. Moreover, it is not travel friendly. The size of each of the pad is very limited, so it might not cover the whole psoriasis area. And lastly, the product can be easily contaminated since each of the pads are not packaged separately. And we also analyze the strength of our bandage, which our product is made of natural ingredients and able to cover scar, that as well preventing scratching, which will worsen the dry skin. Our product is also designed to give cooling sensation, which is able to soothe the skin. The weaknesses of our product is that our product is not environmentally friendly compared to the other product, since it produces more waste, and this brand is still new, in which the customer may not put so much trust to buy this product. And based on the previous analysis, we can map 5 competitors and our product on the value price diagram. And first, let's talk about the quality. The quality mapping is solely based on people reviews and ratings on the Amazon platform, so we can sort the highest to lowest quality, starting from CeraVe, QRX Lab, BiomediSkin, Kenkoderm, and Time Out. And for the price itself, we estimate how much money spent for one day application using these products. CeraVe has the highest price along with BiomediSkin, since we assume in every application it needs 1 pump or equal to 5 ml volume that has the price of approximately 10,000 rupiah. And this product should be applied 3 times, so 10,000 times 3 equals to 18,000 rupiah. And for BiomediSkin, we assume that people consume 1 ml or approximately 10 sprays that cost them 18,000 rupiah. And moving on to the second most expensive, which is QRX Lab. Since this product applied 2 times a day, and assuming in one application people only use 1 pad, so 7.6 thousand times 2 equal to 1.2 thousand rupiah. And next is skin condom. We assume that one bar of soap will completely be consumed in 1 month. Therefore, approximately 137,000 rupiah divided by 30 days equals to 4.6 thousand rupiah. And lastly, the cheapest product is Time Out. The assumption being made is the same build BiomediSkin, in which per day people use 1 ml that equals to 1.2 thousand rupiah. So where is the position of our product in this diagram? Our product has several unique strengths that are new in treating psoriasis. We provide coverage that none of our competitors provide, and also the cooling sensation that comfort the user. Therefore, we are confident that our product has a high quality in terms of pricing. We assume that one bandage is enough for 1 full day usage that equals to approximately 13.5 thousand per day, in which this pricing is still in the middle range compared to the market.
That is all for our presentation regarding our psoriatic bandage resist product, and here are the references that we utilized for research and design for the bandage. Thank you for watching.